Hello, I'm Dr. Debasis. I'm a cardiac surgeon at Narayana Superspeciality Hospital. Today I want to talk about coronary artery disease and give you some awareness tips. What is coronary artery disease? Is basically the heart when it stops receiving enough blood supply to itself. That is what is known as coronary artery disease. Why it happens is because of blockages in the arteries which supply blood to the heart. So if you have any of the documented risk factors for coronary artery disease, like if you are a diabetic, if you are a smoker, if you have hypercholesterolemia, meaning having excess cholesterol in your blood, or if you have a strong family history of coronary artery disease, you are naturally prone for developing coronary artery disease. If you have any of these risk factors, you need to be aware that you need to have regular checkups. After the age of 40, you should do an annual blood tests to screen for any hyperlipidemia, any onset of diabetes, or even a stress test like a treadmill to screen for heart disease. If you have already been diagnosed with coronary artery disease, you should seek a professional help as soon as possible by visiting a cardiologist who, after an angiogram, will decide as to which form of therapy do you need. There are multiple options of treating coronary artery disease these days. So you could either be having a stent to your coronary arteries without an operation by a cardiologist, or if the disease is severe, you might actually require a coronary artery bypass surgery, which is a surgical option for it. All these procedures in the current day and era is completely safe, and the earlier you get treated for a disease, the better your outcome is. So chances are that if you haven't had a heart attack, if your heart is in a healthy condition with coronary artery disease and you undergo a procedure for it, the results would be far better than after you have had a heart attack and your heart has suffered and then we try and treat it. The outcomes might not be optimal. So coronary artery disease is a very common disease in our country, and the incidence is increasing day by day. We are the diabetes capital of the world, so we have one risk factor which is very common. So awareness is the key. So be aware that this is a disease which can happen to any of us. We just need to pick up early and get it treated as soon as possible in a center of excellence which can treat you optimally, give you all the therapeutic option, and take care of yourself and your heart. And coronary artery disease is not something we should be afraid of, as long as we can diagnose it in the correct time and treat it optimally. Thank you.